1 in 5 children in the U.S. suffers from a serious mental disorder.
Many children with a mental illness have experienced abuse, neglect, or violence.
Over 80% will go unrecognized and untreated.
Left untreated, mental and addictive disorders in children can lead to future problems. Many will
have uncontrollable anger, abuse alcohol and drugs,
drop out of school,
become homeless,
attempt suicide.
Children with real complex and serious mental health needs who have the worst outcomes that are also the most detrimental to society have this double whammy of having a predisposition, genetic predisposition towards serious anxiety, depression, suicidality, but they're also much more likely to come from stressed homes and communities and to be children who've grown up in poverty. Parents who are often the linchpin of an effective treatment plan means that 70–80% of children who have mental health problems that would benefit from treatment don't get it.
So when you add poverty to sometimes substance abuse and sometimes mental illness, that can be generational in its origin. It's a big challenge to help these kids see that they can get through it and help them continue to hold on to hope that it's going to be okay and just get through life.
Despite effective treatments, there are long delays,
sometimes decades, between the first onset of symptoms and when a child in need receives treatment.
If we don't intervene with these problems early, then we lose these kids. We're talking about much greater likelihood of school dropout, much greater likelihood of juvenile offending, much greater likelihood of substance abuse, much greater likelihood of having to be on public assistance.
If we can get them the support and get them the help early so that they can be hopeful and successful and do well, then their chances of staying out of that grow quite a bit.
Children with a mental illness can get better. We can succeed. Navos is a part of the solution for kids.
Every year, Navos helps more than 1,200 kids recover from trauma, neglect, abuse, addiction, and serious mental health issues.
It's the culture of Navos to be strengths-based and to form a partnership with our clients and with their families and their natural support networks.
Mental illness in children and adolescents is treatable, and it is our goal to make sure that those treatment services are available to everyone. Navos and Seattle Children's Home have partnered together for over 30 years in a variety of projects that impact the mental health and well-being of the children in our community. What we now understand about mental health and its relationship to physical health, that coming together and building a collaboration to deliver those things across the lifespan is critical to our community.
Any young person can be dealt the bad hand of a predisposition. This is not these kids' fault, and yet we have effective ways to treat these problems, even real serious and complex problems. We owe it to these kids to try to make sure that they get access to those kinds of services.
And if you can give kids a goal and a direction, they have reasons not to do the other stuff. They have reasons not to do crime, reasons not to do drugs, and reasons to kind of be a better citizen in our world. And that's what we're trying to do.
Navos and our consortium of partners serve about 40% of the children who are seen in the King County mental health system.
One of our programs right now has a very strong focus on adolescents, and I think that's a key piece that we bring to the table. We know that kids are in school, we know that families are really busy, so if we can get counselors into schools to see kids there, we can do after-school programs, We can go out into the community. We've been known to do therapy sessions in the park, on the playground, and in family homes. And we think that that makes it much easier to get the treatments that are needed.
When you have a provider organization that's committed to providing things like wraparound and research-based practices, you're helping all of our community's structures that are working with kids.
By becoming a center of excellence for children and families, we're investing in the future for the whole community.
This is what investing in mental health services for children has the promise of achieving.
What we know today is that children can and do recover, and that children's capacity to be resilient is always stronger than what life has dealt them, if they get the trustworthy help in the careful way we provide.
You can help. Be part of the solution.
For the community. For children.